Hello guys, it's Marigold PHM back here again, and I'm so happy to be back here. Today is gonna be amazing, and we're gonna have a very great discussion on a particular drug, doxycycline. Yes, you heard me right, doxycycline. Most of y'all have used doxycycline and have even self-medicate doxycycline. So we're gonna be talking about doxycycline today. But before we move into the video today, I'm so happy to see you guys here again. Welcome to my YouTube channel. Do well to hit the subscribe button and subscribe, like, and follow. Doxycycline, yes, everybody, doxycycline. You have acne, doxycycline, infection, doxycycline. What is even doxycycline? Doxycycline is a broad spectrum antibiotics under the class of drugs tetracycline, and it is effective against gram positive and gram negative bacteria, although it is resistant to some bacteria. What do you mean by gram positive and gram negative? Gram positive and gram negative are classified according to their gram staining, the features are their cell wall are in gram positive, their cell wall have thick peptidoglycan layer, while in gram negative, it has thin peptidoglycan layer, while the outer membrane in gram positive is absent, the outer membrane in gram negative is present. Their gram stain color, yes, in gram positive is purple or violet, while in gram negative it is pink or red. Okay, a quick MOA, that's mechanism of action of doxycycline. Doxycycline penetrates bacterial cell through passive diffusion or active transport. Then doxycycline reversibly binds to 30S subunits in the bacterial ribosome. Bacteria has 30S subunits and 50, making it 70. I don't want to go deep into that. It blocks the attachment of amino acid transfer RNA, yes, to the acceptor A sites of the ribosome. It prevents additional amino acid to grow in the peptide chain, and also as a result, protein synthesis is inhibited, preventing the bacterial from growth and multiplication. Most of us take medication and we don't even know how the medication goes into our body and leaves the body. In pharmacology, it's called ADME. Yes, it's called ADME. That's the absorption, distribution, metabolism, and elimination or excretion. Yes, how the drugs goes into the body and it is out. Mostly pharmacokinetics, that's the movement of drugs in and out of the body. So doxycycline is yet mostly and effectively taken orally, and it is being absorbed absorbed in the GIT. Yes, then take it with a lot of food and water. Yes, then there's some medication that affect anti doxycycline, which is like the antacid and zinc supplement. Yes, they affect doxycycline. Then it is distributed in the body and into the lungs, kidney, and reproductive organ. It also crosses the placenta and also found in the breast milk. That's why sometimes it's not recommended for pregnant women or breastfeeding mother or children under the age of 8. Doxycycline is metabolized, small amounts is metabolized by the liver. Most of the drugs remain unchanged and it is being excreted. It's being excreted via feces or bile, or sometimes small amounts in the urine. Now to the main aim of this video, what the doxycycline is used for, the indication. Most of us, you have yeast doxycycline, you have this doxycycline, you have that doxycycline. No. Doxycycline is actually used to treat most of that, yes, but it is used to treat respiratory tract infections, just such as pneumonia, sexually transmitted infections such as chlamydia, and it's also used to treat syphilis. That's when penicillin is not um alternative for penicillin. Yes, it's also used to treat acne. Talking about acne, I think doxycycline has a lot of side effects for you to be using it to treat acne all the time. I think you should opt in for like skincare products, or you try to like work on your hormones, your gut health, and other stuff instead of using doxycycline to treat your acne. It can also be used to treat malaria and prevent, yes, malaria. Yes, if you're traveling to a place and you know that that place is prone to malaria, you can actually take doxycycline, probably 100 milligram daily, to like prevent malaria. But always take medication under those doctor's prescription, especially antibiotics. Don't self-medicate antibiotics. Always get recommendation and prescription from a doctor before you take any antibiotics. It's also used to treat Lyme disease and cholera. So basically, most of us even use doxycycline to treat yeast. But do you know that you can use doxycycline to treat yeast, and the yeast is not good? The antibiotics even kills the good bacteria that is supposed to be there to help you, thereby making the yeast even grow more. Yes. That is why I always say that take prescription from a doctor. The doctor will know what to do. You cannot just, I have yeast, you want to self-medicate yourself. It's not good. Okay, let's talk about the side effects. Reason I made this video and why I should not self-medicate. Yes, the common side effect is nausea, vomiting, diarrhea, and abdominal pain normally. You that is using the doxycycline to treat acne, do you know it can cause sunburn, photosensitivity? It can cause you sunburn. Then, even if you're taking doxycycline, please, I'm begging in the name of the Lord, take it with food and enough water. Take doxycycline with food and enough water. I know why I'm saying no, because there's one time like that, my sister took doxycycline, and I don't know whether she didn't take it with enough water, because any drug that is encapsulated, that means it shouldn't touch your throat. It's supposed to go down. So you're supposed to take a lot of water. I don't know if she didn't take it with a lot of water or not, but she took that drugs, and the next day she couldn't swallow. She couldn't swallow anything. Her throat was blocked and it was painful. She had sores. That's esophageal irritation. You have sores on your throat. You would doxycycline is, my sister went through hell. She took omeprazole, yes, even so nothing was working. There's nothing she didn't take. She had to even drink hot water. She was just waiting for this stuff to, and till today, I'm sure if she sees doxycycline, she won't even go near. So you need to take it with a lot of food and water. Yes, it causes tooth discoloration. It can cause inhibition of growth, bone growth in the fetus. Yes, then can cause skin rashes and super infection. That is where the super infection is in candida. You use it to treat yeast, candidiasis. Instead of it to treat, it's now making it worse. Overgrowth of resistant organisms, because the good, but you're killing the good bacteria itself already. So it's, I'll always say this: doctor's prescription fit. If the doctors have seen that, okay, this the uses, like the indication of outweighs the adverse effects, they will prescribe. Don't just stand up. A lot of us, acne, doxycycline, yeast, doxycycline, um anything that is wrong, you just want to take doxycycline. Malaria, no, you don't take. You cannot abuse if you keep on taking doxycycline every time. There's what we call anti bacterial resistance. At some point, your body will be resistant to a lot of antibiotics. It will be resistant a lot of antibiotics because you've abused it. That is always usually antibiotics. People don't know that antibiotics is supposed to be taken under doctor's prescription. You cannot just go, you have typhoid, you just take antibiotics. In fact, I'll make a video on antibiotics. so that I'll explain better the antibacterial resistance and side effects of self-medicating antibiotics. So, you that is self-medicating doxycycline, if it was prescribed by a doctor will know this and will tell you. But these are the drugs interaction, drugs you shouldn't take while taking doxycycline antacid containing calcium. It's affects doxycycline absorption, iron preparations, dairy products such as milk, cheese, and yogurt may also decrease absorption of doxycycline. Warfarin, yes, warfarin may increase anticoagulant effect, increasing the risk of bleeding. Enzyme inducing drugs such as carbamazepine, which reduce doxycycline levels. For those of you that may be thinking, what is this is doxycycline? Yes, this medication right here is doxycycline. You can see this is doxycycline. I don't know if you can see very well. This is doxycycline. It should not be taken without doctor's prescription. No antibiotics should be taken without doctor's prescription. It has a lot of side effects than the side effects are, yes. In fact, all antibiotics, their side effects are very bad. Imagine you're taking it to for a particular stuff and it is not causing another stuff. So before you take doxycycline or any other antibiotics, I recommend it should be doctor's prescriptions first. Doctor's prescription first. Because imagine you taking doxy for acne and you went outside, you're having sunburn. Most of us, we are even taking medication without even knowing the adverse effect. We are supposed to weigh the effect, the side effect of this, the side effect of this. Do you know, there's how you take doxycycline, it will cause neurotoxicity like headache, dizziness. It can even cause hepatotoxicity. Yes. So, and antibiotics has a lot of side effects that we should always take precaution. Don't ever take antibiotics. I don't want to talk about antibiotics because I want to have another video on antibiotics. So I'm talking about doxycycline. Don't try to self-medicate doxycycline. Starting from your throat, something can happen to you. Down to your stomach, something can happen to you. Yes, I took doxycycline once like that. Yes, I had to stop it. I had headache, dizziness. I knew it was not. I knew it was not. For what is what, all drugs are poison, sef. They are poison. It's just that some of it, the benefits outweighs the risk sometimes. That's why we take it. So don't self-medicate. Doxycycline for your yeast infection, don't try it. Go to a doctor and get tested. Doxycycline for your chlamydia, yes, it treats chlamydia. Go to the doctor and get diagnose it first. Then the doctor will know the first line medication for it. Doxycycline for syphilis is not even the first line. It's always an alternative to penicillin. So always go to the hospital to know the first line medication first before you take any medication, not just doxycycline, any other medication, because most of the side effects of antibiotics, or even the least medication like paracetamol, yes, acetaminophen, paracetamol, it can cause you hepatotoxicity. Yes, even paracetamol has side effects. So how much more antibiotics? So always get doctor's prescription first. People have different side effects. There are people that it will be as if you took hard drugs, you will be dizzy, you have headache. There are people that their throats, they'll have sores on it, they'll not be able to drink water or drink anything for even up to 3 days, 1 week. So before you take any medication, get a doctor's prescription first. before any other medication, because it actually kills bacteria, but it's even resistant to some of the bacteria. There's always a better alternative. A lot of us take doctors like acne, yeast. Don't do that. So on my next video, we'll be talking about antibiotics. I don't know if it is in my immediate video, but I know that I'll be talking about antibiotics and their side effects. I just wanted to talk about doxycycline today because I've always wanted to talk about it. So if you've not subscribed to my YouTube channel, click on the subscribe button right and down below and subscribe to my YouTube channel. And always wait and anticipate for new good videos. We post videos every day. So thank you for subscribing, and I'll see you next time. Thank you.